Symptoms and diagnosis of complex post-traumatic stress disorder. Complex PTSD is a trauma that an individual experiences due to abuse from a person with power for a long period of time. In those situations, the victim could not escape due to various reasons. Although complex PTSD and PTSD share similar acronyms and symptoms, complex PTSD includes a wider range of problems, such as problems with self-regulatory capacities as emotion and belief system difficulties. The cause of complex PTSD is long-term traumas that include captivity of the body or mind where the victim is powerless against a perpetrator and cannot escape. Examples of situations include neglect, physical and/or sexual abuse for children, long-term domestic violence, concentration or prisoner of war camps, and prostitution brothels. Complex PTSD has been included as a subcategory of PTSD in the 4th Diagnostic and Statistical Manual of Mental Disorders or DSM-4, and therefore includes most or all of PTSD symptoms. There is a 92% comorbidity rate between PTSD and complex PTSD, meaning that they share most diseases that are independent from them but occur following onset of PTSD and complex PTSD. In both patients re-experience symptoms as flashbacks, bad dreams, and frightening thoughts. Avoidance symptoms such as staying away from things that remind them of traumatic experience, guilt, depression, numbness, loss of interest, and difficulty recalling traumatic event. Hyperarousal symptoms where the patient has difficulty relaxing and is on alert. In DSM-3, PTSD was included for the first time after the need for diagnosing returning Vietnam War veterans. Therefore, the criteria was based on trauma from war experienced by adult males. Complex PTSD, or disorders of extreme stress not otherwise specified, or DESNOS, was included in DSM-4 under PTSD to account for differences as symptoms of DSNOS. However, it has been found that the symptoms of DSNOS could exist without the presence of symptoms of PTSD. There are 7 categories of symptoms different from PTSD. They are alterations in the regulation of affective impulses, alterations in attention and consciousness, alterations in self-perception, alterations in perception of the perpetrator, alterations in relationship to others, somatization and/or medical problems, and alterations in systems of meaning. The definition of comorbid symptoms is one or several diseases that occur simultaneously with another but are independent of each other. The National Comorbidity Survey found 84% of individuals with PTSD had at least one other psychiatric disorder. These comorbid disorders are found in the axis 1 and 2 of disorders, in which axis 1 includes depression, anxiety disorders, schizophrenia, and others. Axis 2 disorders include paranoid personality disorder, borderline personality disorder, avoidant personality disorder, and others. There are many assessment techniques for adults that a health professional can use for patients with complex PTSD. Trauma exposure interviews targeted towards adolescents and adults include the following listed: potential stressful events interview, stressful life events screening questionnaire, traumatic event scale, stress diagnostic scale, detailed assessment of post-traumatic stress. There are also self-report methods which are relevant to the Axis 1 symptoms of the DSM-4. Traumatized individuals typically score higher on negative impression scales. They are the Millen Clinical Multi-Axial Inventor, Minnesota Multiphasic Personality Inventory, and the Psychological Assessment Inventory. Unfortunately, there are few assessment approaches for children concerning complex PTSD. Some examples are Child Behavior Checklist, Trauma Symptom Checklist for Children, Child Sexual Behavior Inventory, and Personality Inventory Adolescents. The Child Behavior Checklist is frequently used for assessing general psychological distress in children. It is often used for those with childhood abuse. The form is completed by a caretaker or teacher if the patient is very young. Otherwise, it can be self-administered for ages 11 through 18. Versions for young adults ages 18 through 30 are also available. The Trauma Symptom Checklist for Children uses self-reported symptoms from ages 8 through 16. It measures for anxiety, depression, anger, post-traumatic stress, sexual concerns, and disassociation. Generally more geared towards PTSD symptoms, however, includes much comorbidity that can be integrated for complex PTSD use. The Child Sexual Behavior Inventory observes sexual behaviors of children ages 2 through 12. It tests for areas associated with childhood sexual abuse, which includes boundary problems, exhibitionism, gender role behavior, self-stimulation, sexual anxiety, sexual interest, sexual intrusiveness, sexual knowledge, and voyeuristic behavior. Older adolescents can be assessed with the Minnesota Multiphasic Personality Inventory Adolescence Test.